Alopecia areata is a really difficult disease. If you haven't spent a lot of time with patients who've had it, or if you don't know somebody who's gone through it, it's sort of easy to think, oh, it's just hair, or it could be worse. So, at least they're not sick. And in fact, most patients who have alopecia areata or family members of patients have heard this over and over, including from healthcare providers. I will say that sort of any degree of alopecia areata is usually very difficult for patients. And in most cases, I really do think that it's traumatic. And again, that might seem like sort of an extreme thing to say, but if you really spend the time talking to people, you will learn that really is true. I think it's really important for us as healthcare professionals to acknowledge that this is hard. A lot of these patients have sort of been dismissed and said, "Oh, well, why are you so upset about it? Or you could wear a hat, or you could wear a wig." But it's really not that easy. And when you're having a hard time with something, and you're going to somebody who you're hoping can help you, and you get that response, it's really sort of adds to the difficulty of it. So I think, just even starting a visit saying, "Hey, how are you doing? This is hard," kind of putting it out there for them and normalizing and validating their experience, I think is really important, because then the patient is going to feel more comfortable. They're going to feel like you kind of get it. And then they may be, more willing to think about treatment that you have to offer, or at least just open up with how they're feeling.